Welcome back to our channel, where we delve into important health topics. In today's video, we will be discussing a question that many women may have: can fibroids cause bleeding after menopause? We will explore the facts and provide you with valuable information on this topic. So, let's get started. Before we begin, let's quickly recap what fibroids are. Fibroids, also known as uterine leiomyomas, are non-cancerous growths that develop in the uterus. They are quite common and often occur during a woman's reproductive years. However, what happens when fibroids persist even after menopause? Can they still cause bleeding? Let's find out. To understand if fibroids can cause bleeding after menopause, it's essential to explore the underlying causes and the symptoms associated with fibroids. Typically, fibroids develop due to hormonal imbalances, especially high levels of estrogen and progesterone. These hormones influence the growth of uterine tissue. As women approach menopause, their hormone levels begin to decline, which often leads to the cessation of menstrual periods. However, in some cases, fibroids that were present before menopause may still persist, and they can continue to cause symptoms even after the menstrual cycle has stopped. Now, let's address the question at hand, which is: can fibroids cause bleeding after menopause? The short answer is yes, although it is relatively rare. Studies suggest that about 5% to 10% of women with fibroids may experience bleeding or spotting even after menopause. The bleeding that occurs after menopause due to fibroids is often referred to as postmenopausal bleeding. It is crucial to understand that any form of bleeding after menopause should be evaluated by a healthcare professional, as it could indicate an underlying health condition. So, how do fibroids cause bleeding after menopause? Well, it's believed that the remaining fibroids, which were present before menopause, can still receive some blood supply from the surrounding tissues. As a result, these fibroids can continue to grow and degenerate, leading to bleeding or spotting. Additionally, fibroids can sometimes develop new blood vessels to sustain their growth, which can contribute to bleeding even after menopause. The decline in estrogen levels during menopause can trigger the growth of these new blood vessels, causing bleeding or spotting. While bleeding after menopause due to fibroids is usually benign, it's essential to consider potential complications. In some cases, the bleeding may be a symptom of other serious conditions, such as endometrial cancer. Therefore, it's crucial for women experiencing postmenopausal bleeding to seek medical attention promptly. Our healthcare provider will likely conduct a thorough evaluation, including a physical examination, imaging tests, and possibly a biopsy, to determine the underlying cause of the bleeding. It's always better to be safe and have a professional assessment to rule out any significant health concerns. If it's confirmed that fibroids are indeed causing bleeding after menopause, various treatment options are available. The most suitable treatment depends on factors such as the severity of symptoms, the size and location of the fibroids, and the individual's overall health. Conservative approaches may include hormone therapy or medications aimed at controlling symptoms. However, for women who experience significant bleeding or discomfort, surgical interventions, such as myomectomy, removal of fibroids, or hysterectomy, removal of the uterus, may be recommended. It's important to have an open and honest discussion with your healthcare provider to determine the best course of action for your specific situation. In addition to medical treatments, there are also some lifestyle changes that may help manage symptoms and reduce the risk of bleeding after menopause caused by fibroids. These include: 1. Maintaining a healthy weight. Obesity can contribute to hormonal imbalances, which may exacerbate fibroid symptoms. By maintaining a healthy weight, you can potentially reduce the severity of symptoms. 2. Eating a balanced diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can support overall health and potentially reduce the growth of fibroids. 3. Exercising regularly. Regular physical activity can help regulate hormone levels and improve circulation, potentially alleviating fibroid-related symptoms. Lastly, managing stress. High levels of stress can disrupt hormone balance and worsen fibroid symptoms. Engaging in stress-reducing activities such as meditation, yoga, or hobbies can be beneficial. In conclusion, while it is relatively rare, fibroids can indeed cause bleeding after menopause in some cases. The persistence of fibroids and their blood supply can lead to postmenopausal bleeding or spotting. It's essential for women experiencing such symptoms to consult with a healthcare professional for proper evaluation and diagnosis. Remember, any bleeding after menopause should be taken seriously, as it can be a sign of other underlying conditions that require medical attention. Timely diagnosis and appropriate treatment can help manage symptoms and ensure your overall well-being. That's all for today. If you have any further questions or experiences to share, please leave a comment below. Don't forget to subscribe to our channel for more videos on women's health and wellness.